Hydrocephalus develops as a result of an imbalance between the production and absorption of cerebrospinal fluid, and as that excess cerebrospinal fluid accumulates in the ventricular system, the ventricles become dilated, the brain is compressed against the skull, and that results in enlargement of the skull if the sutures are open. It results in signs and symptoms of increased ICP if the sutures are fused or closed. And that leads us to an important point with little babies that come in with hydrocephalus, or especially our premature babies, because you see this a lot in our premature infants that are born, or babies that are born with not only hydrocephalus, but also born with spina bifida. So the most important take-home point with this is that we want to make sure that we do head circumferences on these little ones. We want to make sure that we palpate their anterior fontanelles, posterior fontanelles. We look for bulging of the anterior fontanelle, and that's very, very indicative of hydrocephalus. We'll get into some more signs and symptoms as we go, but one of the biggest take-home points is we've got to monitor their head circumference and their fontanelles. The signs and symptoms: infants, they have rapid increase of the head circumference or unusually large head, vomiting, irritability, sleepiness, seizures, that downward deviation of the eyes, kind of what they also call as sunset eyes. You'll see that they have the bulging. I think there's a really good picture in 28.4 on page 746, and also on page 745 of a child that has the increased ventricles, and you can see how the brain is pushing, the ventricles are pushing against the brain tissue, and it enlarges the head. Before they had the ventricular peritoneal shunts for these children's heads, I had seen one, used to be called Sunland Hospital in Orlando, and they've since closed that many, many years ago. But their head, I'm trying to get a size for you, their head was probably 10 times as big as a normal head, normal adult size head, to where you actually had to pick up their head and you had to turn it at least every hour, because the child could not raise their head, obviously, and they would get pressure areas on their head just because of laying on them for a long period of time. If it was really sad, a real sad situation when we saw that. So thank God for the VP shunts, and we'll go over those in a few minutes. In children, you can also have all the symptoms of ICP, and we're not specifically going over those this semester. However, it's always good to know that if a child develops a headache, especially if they had been born prematurely or had a bleed as an infant, they develop headache, vomiting, nausea, papilledema, swelling behind the eyes, blurred vision, diplopia, poor coordination, drowsiness, that irritability that we often see, that cognition changes with memory loss, personality changes, those types of things. So in our lab diagnostics, in utero, they can do an ultrasound, and they can, rule out. At any age, we can do a CT or an MRI, and maybe a lumbar puncture would be done as well. In order to intervene with and manage these children, with hydrocephalus, we're going to do a surgical incision and we're going to put a shunt in. We usually it's called a ventriculostomy, and we put a shunt into that, into the ventricle of the brain, and then it is threaded outside of the brain, underneath the skin, down the neck, and we can either place the end of the shunt into the peritoneal cavity, or it can also go into the aorta. Most of the time it is shunted in the peritoneal cavity, and that cerebrospinal fluid then is reabsorbed into the circulation and into the bloodstream. Our nursing care with these children are to measure the head, and even when they have a shunt put in, especially if those fontanelles are open, that's real important. Assess vital signs, temperatures every 1 to 2 hours, and we're going to do our labs. We want to always monitor for seizures, any personality changes, very important. And, listen to our mamas. Our mamas are our best teachers when it comes to pediatrics. Mamas know best, so always listen to them. Observe for any drainage after surgery, and you always position them off of their surgical site. And usually there's antibiotics that are going to be prophylactically ordered for these children. So we're basically going to be teaching our parents about dressing changes, especially post-op, and how to recognize any type of infection, and proper positioning of the infant, and to monitor for any pain and discomfort. Usually, when we monitor for infection, we're looking at temperature, but we're also looking for that irritability, especially if this shunt is infected or obstructed. Obstruction, parents cannot be taught more and more and more, because it's so important that we teach them all the different signs of increased intracranial pressure, and they can do their little baby's head circumference every day and do a little chart for that, and that would be real important for them to be more proactive in taking care of their infant child. Before we go on to spina bifida, I just wanted to mention, when these babies do come into the hospital, sometimes their shunts have to be revised. Sometimes the surgeon, they'll take them to the OR and just totally put in a new shunt, or sometimes they may have to keep the shunt in, give them antibiotics for a while, or and then do the surgery, and then they monitor the patient. Sometimes they even take the shunt and they'll put it to the outside of the body, take the end of it. It's the one point is in the ventricles, and the other one is almost like a Foley catheter that comes out, and that the end of that has to be about the same level of the head to prevent increased intracranial pressure. So there's different ways that they handle infections, and especially in a big pediatric hospital, and how they treat the child with hydrocephalus that has a VP shunt that has become infected. The other thing is that you can feel there's a little there's an area behind the ear usually, or a little bit above the ear, that they will say pump the shunt like 10 times, per shift, or however the physician wants it ordered, because maybe if it's not working, there's a little area that we can actually just take our two fingers, or one finger, index finger, and just pump that shunt to drain it down into the peritoneal cavity. Okay, I think that's it for hydrocephalus, and we will continue with spina bifida in a few minutes.